Hi, I'm Katie Meyer, and I'm the new Montana HOSA State Director. I'm working on a few videos for you guys today. These videos are just an overview of what to expect in some of our technical skills competitions that take place on the Wednesday at the State Leadership Conference. So those are the health professions events and the emergency preparedness events. Today's video is about nursing assisting. Most of the students who compete in this, I would say, are in or have taken a nursing assisting class. And so if you're just kind of starting out in HOSA, you might look at some of our similar events that might be a better fit for you, such as home health aide or medical assisting, because this is an event that does have quite a few students who don't get to advance on to round 2 because we have so much interest. And so something to think about as far as who you might be competing against in that. So in all of our Wednesday events this year, we are looking at doing the cutting process a little bit differently. There's more information about that on the Montana HOSA website, on the Gotta Have It short and the short sheets, the Gotta Have It list. But you will submit a video component to show us that you are learning and know how to do some of the skills. You'll also take an online test during that online testing window. Between those two things, then we will let you know if you've qualified to move on to round 2 at the State Leadership Conference in Billings this year. At the State Leadership Conference in Billings, then you would do the technical skills again in front of a judge, and you might get 2 or 3 of these that I'm going to go over with you, and so you should be prepared to do them all. You should know that we are using clinical lab space at City College this year, so you will have access to patient mannequins. It may be a live patient for some of your events, but we do have nursing beds, so you should make sure you kind of know how to use the proper equipment for those things. So in the nursing assisting event, the skills that you would be required to know how to perform, again, you wouldn't get all of these, you would get 2 to 3 of them, are hand washing, properly donning and doffing full PPE, making a closed bed, and then making an occupied bed, so your patient's already in there and you need to kind of change those sheets out, admitting a patient into your clinic or hospital setting, transferring a patient with a specific disability. So this might be a live person mimicking being your patient, and we might say that they have an injured shoulder or an injured hip, and we want you to help move them from a bed to either a chair or a wheelchair, so knowing how to work the wheelchair devices and the stops. Again, these things are all on the guidelines, and I'm going to be making instructional videos to help you learn some of that stuff. You also need to know how to measure and record your patient's vital signs and care for an ostomy. So those are all the skills that would be expected for you to perform in the nursing assisting event. Please reach out if you have any questions.